A 69-year-old woman presents to the emergency department with a complaint of 3 days of left lower quadrant abdominal pain, nausea, vomiting, and a sudden change in bowel habits. What are you most likely to find on an abdominal and pelvic CAT scan? Go ahead and hit pause. Okay, we are back. So this is a second order question. We first have to identify what the diagnosis is and then know what the findings are on CT for that diagnosis. And the key to this question is first noting that the patient is older. They're 69 years old and they have left lower quadrant abdominal pain, and this is over 3 days, so it's acute and it's associated with a change in bowel habits. So if we go through each answer choice and look at appendiceal wall thickening, we know that appendiceal wall thickening is associated with appendicitis, and appendicitis is the right lower quadrant most commonly, and therefore that is incorrect. Next, let's go to dilated loops of small bowel. This is associated with small bowel obstruction. The key to small bowel obstruction is most likely on physical exam, the patient will have diffuse abdominal pain, and most importantly, the question should almost always state that they have abdominal distension, which we do not see in this vignette. And so this is going to be incorrect, or a less likely answer choice. And then we have enlarged pericolonic lymph nodes. Pericolonic lymph nodes are typically associated with, let's say, a colon cancer. And while colon cancer can be associated with a change in bowel habits, this came on suddenly, and there is left lower quadrant pain that is sudden here as well. So it is not the most likely finding. So if we go to colonic diverticula, first, if we say that the diagnosis here, left lower quadrant pain in an older patient with a change in bowel habits, is consistent with acute diverticulitis. Well, diverticulitis stems from diverticulosis. And so the best answer choice here is colonic diverticula. And sure enough, we're correct. If we see what other users have selected, B was the most commonly answered choice. Next was dilated loops of small bowel. But as we know, this is consistent with abdominal distension and abdominal pain. And so if we look at the graphic for acute diverticulitis, we note that it stems from diverticulosis, and it is a complication of diverticulosis. Diverticulitis itself can be complicated in about 5% of cases, and it's associated with abscess, obstruction, perforation, and fistula. The most common clinical presentation is abdominal pain, and it's almost always in the left lower quadrant for exam purposes. If it's in the right lower quadrant, it's typically in younger patients and is more severe. However, right lower quadrant abdominal pain on exams is very commonly due to acute appendicitis. You diagnose diverticulitis by CAT scan. It is very good at it, and you will typically see diverticula, pericolonic fat stranding, and bowel wall thickening. The management is going to be antibiotics in all cases, and complicated cases are going to require surgery. If we look a little further into the answer choice, the incorrect answer choices here, appendiceal wall thickening is associated with acute appendicitis, and the takeaway here is appendicitis begins with periumbilical pain that radiates to the right lower quadrant and is associated with fever, nausea, vomiting, and anorexia. A classic physical exam finding is tenderness at McBurney's point. And now if we move to small bowel obstruction, we will see that the most common cause of small bowel obstruction is adhesions, and then we have hernia and neoplasm that come after that. A classic finding on X-ray is going to be dilated loops of bowel with air fluid levels. So anytime you see air fluid levels on an abdominal X-ray, think small bowel obstruction. Lastly, we have colon cancer. The classic radiographic finding here as well is the apple core lesion, and this is symbolic of colon cancer. If we look at our one step further question, what diagnostic exam should not be performed if acute diverticulitis is suspected due to the high risk of perforation? And my guess here is going to be any type of instrumental insertion, so colonoscopy. And sure enough, that is correct. And if we look at the rapid review here for acute diverticulitis, let's sum it up with your patient will complain of abdominal pain that is localized to the left lower quadrant. Oftentimes will have fever, nausea, vomiting, and a change in bowel habits. Now, a classic thing to confuse students in this question of acute diverticulitis is bloody stool. Acute diverticulitis typically is not associated with bloody stool. You can have some, but if you have lower GI hemorrhage, that is typically going to be acute diverticulosis or AV malformation bleeding. On physical exam, patients will have guarding, possibly rigidity and rebound tenderness. They may have peritonitis, and the diagnosis is made by CAT scan, and treatment is always with antibiotics, and if it's complicated, then it will be surgical. For references, and that wraps it up, acute diverticulitis.